Okay, so why don't we go ahead and get started? Good afternoon, everyone. Thank you for joining today's HSC Inclusive Excellence Council meeting. I'm going to ask Reese, if you could please pull up our PowerPoint slides and we'll go ahead and get started. It's going to be quite a packed agenda today with phenomenal speakers. We're going to start off with our welcome and acknowledgements. On behalf of Dr. Romero-Leggett, as you all know, who serves as our Vice President of Diversity, Equity, Inclusion here at the Health Sciences Center, welcome to today's meeting. I'm serving as Acting Vice President as Dr. Romero-Leggett is away on sabbatical. So she's on sabbatical right now till November and December, but she sends her regards. Can I have a volunteer read our land acknowledgement? If anyone is willing to volunteer and read our land acknowledgement.
Hi, I can do it. Land acknowledgement. Founded in 1889, the University of New Mexico sits on the traditional homelands of the Pueblo of Sandia. The original peoples of New Mexico, Pueblo, Navajo, and Apache, since time immemorial, have deep connections to the land and have made significant contributions to the broader community statewide. We honor the land itself and those who remain stewards of this land throughout the generations, and also acknowledge our committed relationship to Indigenous peoples. We gratefully recognize our history.
Great, thank you, Mandy. And as you know, we're starting off with new leadership. If you wouldn't mind introducing yourself.
Sure, I'm Mandy Collar. I'm an MD PhD student here at UNM School of Medicine.
Great, thank you. Next slide. Okay, so I believe Dr. Sidonis is here for the EVP update. Dr. Sidonis.
I don't know if I see him on, but he should be logging on any minute now, JP.
Okay, thank you, Gina. So
there he is. He's connecting now. I think he's just connecting to audio now. So Dr. Z, you're on.
Great, thanks. Sorry, everybody, running a little late. Good to see everybody. I'll be really quick. We have our implementation teams doing really great work. We have the health equity team that's also put together a super RPSP that has 4 teams working together. And so we'll see how those funds flow. DEI, you all will be leading one of our accelerators that will, because we believe DEI, inclusive excellence across all our 7 strategic priorities will be helped by the work you're doing. We had, right now we're in the thick of the RPSPs and juggling how to manage that part. But I'm going to just stop at that point and be brief and say thank you all for your leadership. And I'm excited to hear the rest of the hour.
Thank you so much, Dr. Sidonis, for always joining us and providing an update, and most importantly, keeping DEI as a priority at the Health Sciences Center. We're going to enter into announcements. We have just a couple of announcements and updates. Also, feel free as we're going through them to note additional announcements in the chat box or raise your hand and we'll call on you as well. Next slide. So I'm going to ask for, and please correct me, Anastasia, if I mispronounce your name, for Anastasia de Juanamaker Romero to introduce themselves as our College of Population Health student representative. So Anastasia, if you could share a little bit about yourself.
Hi, thank you. No problem on the name. I've got a long, complicated name. So my name is Anastasia Grace de Juanamaker Romero, and I'm a College of Population Health student. I'm completing my Master of Public Health. I'm also a UNM undergrad alum. I got my bachelor's degree in psychology with a concentration in addictions counseling in 2020. So, and right when the pandemic's hitting. And I'm very excited to be on this council because I think this is an important integral part of the growth of HSC. So I'm excited to contribute and also to represent sort of the perspectives of the College of Population Health student body as well. I currently am serving as the co-president of our Graduate Student Association, and so very invested in having student insight heard on a higher level. Thank you.
Well, welcome again, Anastasia, and thank you so much for being the voice of the College of Population Health students and learners. As you all know, we've been working with you all to identify student and alumni and faculty and staff reps as leaders of the IEC. We are still in need of a student representative for the College of Nursing and Health Professions. So as you encounter our talented College of Nursing students and our health profession students, please encourage them to serve in this capacity. And I just want to thank again Director McLaughlin, Shelley McLaughlin, and Dean Carolyn Montoya for the support in identifying these representatives and leaders. Next slide. As you know, we continue to have a unified effort to support Heritage Months. Many of you have continued to champion Heritage Month activities. And for the upcoming 2023 to 2024 academic year, we're increasing our Heritage Month activities from 7 to 13. And this really just is a reflection of work that you were already doing. So it's an opportunity for us to collectively honor, acknowledge, and celebrate the important contributions of 13 federally recognized Heritage Month activities over the upcoming year. The next Heritage Months to be mindful of is Hispanic Heritage Month, September 15th to October 15th, Disability Awareness Month in October, and Native American Heritage Month in November. You should have received several links to engage you as participants on the planning committee, but also if you're unable to make the designated dates and times, please submit your ideas that your school or entity is currently working on so we could add it on our unified calendar. So thank you everyone for your contributions for the Heritage Month activities. Next slide. Dr. Smart, if you wouldn't mind sharing your next Community Connection and Reflection Book Club.
Of course. I am always glad to share what we're reading as a group. This for July and August, we are doing a book called The Pearl That Broke Its Shell. A fantastic read. I'm just about done with it, which takes a look at gender roles and the cultural historical moment in the country of Afghanistan. So hopefully there's an interest in reading the book, and if you're available to come chat with us at one of our meetings and enjoy the reflection and the connecting that we do on this book as well. So thank you.
Great. Thank you again, Dr. Smart, for your leadership in the book club. Dr. Flegg.
Good afternoon, everyone. So out of this wonderful committee, which has a community engagement subcommittee or committee that I've been excited and honored to co-chair here since the IEC launched, we really created the event that you see here. It's going to happen in almost a month exactly on our campus, bringing some community voices that I think can really help us do community engaged work better, and hoping to have a kind of best practices for community engagement that actually comes out of this 4-hour symposium. And would invite y'all to share the word. I'll put in the chat, I'll put the link for registration, which has a little more information. It's going to start with lunch in that first hour, and a lot of our HSC leadership, deans of the various colleges, are going to be in attendance. So it's really a chance not for UNM to brag about the work we're doing, but really to sit back and listen to community members and then some of our more community engaged leaders on our campus talk about what they've seen and learned. And so our HSC DI office and School of Medicine DI office are, I'd say that the core ones putting it on with some really great partners around the HSC and community organizations that are partnering. So there's your invite. Students, staff, and faculty are invited to attend.
Excellent. Thank you so much, Dr. Flagg. Just want to afford an opportunity in case we missed any announcements. If anyone would like to share any upcoming events across the HSC, if we want to honor or celebrate any achievements of any of you or members within your entities. So we'll just pause and take a minute. Any other announcements? Dr. Z?
Not an announcement, but I always get inspired by Dr. Smart. And I've been talking amongst my team about selecting a book for all of UNM Health and Health Science. And so you all may have an idea around that when I saw the book club activity, but I'd like to think about maybe bringing in a national type person who's written a book on something and where it could be a read, and you all would have a good lens on the kind of book. You know, it could be like right now I'm reading a book on belonging, the science of creating connection and building bridges. All right, I'm not saying that's the one, but I've been browsing it myself because I was thinking it. So it would definitely have to be a book that is in the inclusive excellence space. It might have some other kind of spin on it. This one had a little more academic spin to it, but I really love your advice on some books to think about, because and then I have contemplated the creative tension between finding a New Mexican author versus somebody in the space who happens to live somewhere else. But I would be also open to kind of thinking about that creative possibility. So, you know, of course, Anthony's book could be the book. All right, just kidding. But any ideas, and I don't need to take any space here, but love to, and thank you, Dr. Roybal. So we'll come back to you on this one, but I just wanted to say it since I saw Lindsay do her thing.
Great, thank you for that important suggestion. I think it's a great partnership with HSLC as well. I think, Mandy, would you like to share what you put in the chat box?
Sure, and I think Millie Ledwith is also on the call, but Community Engagement Office has been partnering with some of the student groups to create a nonpartisan voter registration drive at UNMH. It's a week-long voter registration drive, nonpartisan, between August 7th and 11th. And we welcome faculty, but it's mostly aimed towards students to volunteer for a 2-hour shift just to help patients, staff, and faculty vote, with the idea that engaging in the civic process makes our communities healthier.
Thank you for that. Okay, so we'll come back to any additional announcements. Remember, feel free to place it in the chat box, and we'll also have some minutes towards the end where if anything else comes up, please feel free to bring it up. So we're going to transition to 2 presentations by our distinguished colleagues, Dr. Smart and Dr. Singh. Dr. Smart is going to present first on the efforts of the Workforce Development Committee. Dr. Smart?
Yes, that will be me. And I am in phone computer mode and going to utilize least if possible to share my slides because my computer is not quite fast to share So I'll give you some moment if they're available to pull those up. And
Did you say you needed me to
Dr.
pull it up
Singh,
for you, Lindsay?
that would be great if you could.
Oh, yes, I can do that. Thank you.
Perfect. Thank you. You know, our committee, Dr. Singh is and I hope for just this opportunity to briefly share what we have been working on in the last year, and a little tiny taste of some of the data that came from our workforce development survey, with much more to come. And then an opportunity to talk about our future directions, and then hand it also over to Dr. Singh for anything to add that I've missed, and also recognizing that many of our committee members are also on this call. Okay, so if we could go to the next slide for me, Lise. And what we have on here, and I am happy to make these slides available afterwards too, because there's a lot of text on a couple of these, was a lot of planning. When we started this IEC, it still feels like it was just yesterday, but it was a large task to think about what it even meant to consider workforce. And then after that, think about what does it mean to consider workforce development across such a large, complicated entity that is CHSC. So for many, many meetings, we kind of circled and danced around what it is to do first in defining our workforce and our goals on top of that. And so we created an action plan, which is very much in its draft phases. But what you'll see on this slide and the next few slides are some iterations of where we're going with this action plan, and the elements of how we're considering workforce in the context of our work. Some of this language in this document slide here was also pulling from existing language that we already have in our system that defines workforce, whether that's through our policies or previous strategic planning. And then we will also need to look to align this document, this statement, as well as our action plan with the forthcoming strategic planning on workforce development, because at least in early iterations of that strategic plan, there is a very large focus on workforce and workforce needs for the UNM and the health system. And so we'll be looking to align those as well. The key part in thinking about this slide here is a broad picture of what the workforce at UNM can be in helping to align the various ways that we might want to think of interventions or resources that would be used to fulfill the workforce development needs of our community. Go to the next slide for me, please. So the next few slides, what you'll see are ways that we have unpacked, I think it's 4 or 5 specific workforce areas. There are many of us on this call who probably sit between a few different workforces and not solely in one. And what our task was here was to try to at least come up with some parameters to think about who fell within which workforce and what that might mean for any other activities that we recommended or suggested through the rest of the work of the committee. So this first one here is the patient care workforce. And that is a way for us to capture the clinical workforce that is operating across all of our different hospital, inpatient, outpatient clinics, different specialty centers, the medical group, and an emphasis on what our work can be to help diversify a workforce that's reflective of New Mexico. And the next one was the research workforce, trying to capture those individuals who may be faculty and staff, learners, and providers who might sit between faculty and staff in our role as an institution in developing research programming, applying for external funding, training future and current researchers, and the role of disseminating that information to the broader community. So that's how the research workforce has been defined thus far by our group. And the next one we have here is the education workforce. This one was was maybe the hardest one we had to define, because we also have a specific subcommittee that overlaps significantly with this definition. So we relied on some cross communication with the education committee in trying to think about our role as HSC and in the Inclusive Excellence Subcommittee on pathway programming, the importance of those who may not yet quite be in our education workforce or in our patient care workforce or in our research workforce, but are still very much our pre-workforce, and how important it is for our workforce development to include those individuals as we facilitate connecting and moving them into our UNN HSC workforce. And so an emphasis on those individuals who are facilitating those types of programming, which really cross-cuts patient care and research, as well as the next one, which is community engagement. Our community engagement workforce was a way for us to recognize the unique place and responsibility of our institution in the New Mexico community, and the bi-directional opportunities to communicate with and partner with our communities through the work of community engagement. So those individuals who are in all aspects of our system that work to assist the development of programming partnerships with our community, and also overlaps with the ability to recruit and retain individuals from our New Mexico community. And then the last one that we had was probably a placeholder. We're welcome to keep talking about how do we capture what we ultimately ended up naming an ancillary personal workforce, which is those individuals who sit in the seams really of all of these previous workforce to facilitate the work, whether that's safety, whether that's access and transportation, whether that's administrative work that specifically helps with policies and procedures, whether that's those individuals who help keep our facilities clean, those who help in our technology realm. So trying to capture what is actually a really diverse group seems a little hard to put it all into one group, one specific entity, but recognizing the importance of naming those individuals at least as a very integral element of our workforce, and likely one that misses out on opportunities for workforce development just by the nature of kind of sitting in the seams of our more specific workforce. Okay, so the next slide, what I wanted to put here was just a placeholder for the slide. The survey that we conducted was a workforce needs assessment. This is by far not a solid research run survey. And I think as we started to analyze the data, we've captured some of the things that probably should have been done better. And so, but the data that we have is what we have, and we can use it to kind of cross connect it with other information in the system. So it still was very useful, but also recognizing that we probably have many research heavy folks on here. When the report comes out, we'll see some ways that this could have been improved. But it was an opportunity for us to try to guide some things. We didn't quite know where to go, to be completely honest, around this very large task of workforce development. And so we were hoping to gain some larger input from specific elements of our workforce to at least give us a little bit of a hint of things that might be useful. And so the link, when you get the slides, you can click on and click through it and see the questions that were asked if you didn't have a chance to complete it. It is closed, although the link continues to be active so that folks can see what was actually asked. All right, the next one next series of slides is just a quick peek at, so you can see who demographically we captured so far. in the survey. And then at future meetings, we'll have an opportunity to start sharing the data after the subcommittee takes a closer look and tries to make clearer sense of it. So this slide here shows the various race and ethnicity of individuals who selected completed the survey. The goal of this was to align our data where possible with the existing way that our system collects race and ethnicity data. It is not a perfect science, but it also allows us to compare and contrast in a way similarly across our system. The next slide, you'll see information about the gender identity of individuals that were completed the survey, again, aligning with where possible with the way that the information is collected within MyUNM. The next slide is our veteran status slide, in the way to align our information again with the way that veteran information is collected from our system. The one after this is on our disability status, ability to, the question for this one is also asked very similarly to how disability status is asked in MyUNM level web. And then we have a slide showing the different primary entity affiliations for individuals who completed the survey. And we have, I think, while the numbers might be smaller in some of these categories, at least we were able to capture some information from a large portion of our the health system. And then the next one shows our professional and educational roles with the ability for individuals to indicate if they were faculty and staff primarily, but also trying to capture the vast different types of learners that we have on our campus as well. And then the next one is our primary workforce area. The specific areas that were selected then allowed individuals to complete questions very specific to those areas. So if somebody selected that they were in education, all the questions that followed were related to the education workforce. And if they selected research, then those would have been questions specific to the research workforce to try to allow us some way to differentiate among the data when it came down to it. The last slide I have here is just an indication of some of our next steps. Obviously, we're in the phases of analyzing and putting together a report of the data from the needs assessment. So that'll be the next thing to be reported out. With that data, and maybe at the same time, continuing to develop the action plan to figure out where we're going, and so that the work of the committee can continue with whatever makeup of the committee is there. So a document to help guide that work. And then also recognizing the importance of aligning what we come up with our institutional strategic plan on workforce development, because there are some clear areas of overlap with the workforce needs in that strategic plan. So with that, I will stop, and before opening it up for questions, turn it to Dr. Singh if there is things to add, other important elements to contribute. I definitely want to give you some space too.
No, I appreciate that. I think that was a good overview. If there's questions, we could always be glad to entertain those. And I would also open it up to the other committee members whose work has been really invaluable on that committee if they have anything else they would like to share as well. And thank you for that great presentation, Lindsay.
Thank you so much, Dr. Smart. And I think, you know, what I really appreciate about the description is it aligns nicely with our climate assessment survey. You know, what I heard is new groupings of workforces, a definition using standardized questions that we currently use, so it makes the data comparable. And after collecting the needs assessment survey, also moving towards action plans that align with HSC's and the university strategic plan. So thank you for that very thoughtful approach that aligns nicely with our other efforts in IEC and the HSC Office of DEI. We have about, I would say, 5 minutes for any questions, comments for Dr. Smart.
Dr. Smart, where do you think our next big steps are in this realm? Like what does all this lead to in your mind over the next 6 months?
I'm always sort of cautious of thinking of big step questions without knowing what the data is, because the data could indicate something else. But I do think that one general important element is how we, both from a recruitment and a retention perspective of a workforce, is what is it that we provide opportunity for individuals to further their growth, both as professionals and as people. I think that that is an important element of why people stay where they do, and why they want to work in certain places as an opportunity to grow and whatever that might mean for them. And I think that there's the elements of workforce development and that I'm hoping that the data captures. But I think just from a just sort of my psychology hat, I guess I'm wearing is the importance of spaces where people feel like they can grow in some way are important. But I'm open to my subcommittee if there's other things.
Just one other thing I would also mention is, we had a number of surveys go out within the past kind of 18 months, if we look at that collectively as an institution. And I think while each of those was necessary, each of those address specific questions, and they ask sometimes certain themes in different ways. Something that Lindsay and I have also been chatting about is potentially accessing a lot of those, some of the raw data on some of those and some of the collective data to see what are those overall themes and action plans that came to fruition and where are those going to. I think that would be interesting to see as a collective HSC entity if we were to apply some of the surveys that have been out there, whether it's from GME, whether it's from Dr. Crandall's group, whether it's from some of the things that Lindsay has just gone over. I think it would be really interesting to see.
Dr. Smart, thank you for your presentation today. I'm also grateful that you and Dr. Ziadonis had an opportunity to welcome our new faculty during faculty quick start orientation. That was an important reminder that we constantly have amazing talent that's arriving at the Health Sciences Center. And today's meeting is indicative of new members that are joining the Inclusive Excellence Council. So we encouraged individuals to look at the committees and the Inclusive Excellence Council. And it's an opportunity for us to further engage individuals across health sciences to support efforts, including workforce development. So thank you, Dr. Smart.
Definitely glad to. I also saw the question in the chat that I can respond to. Go ahead, JP.
Oh, no, I was going to say, I think that was from Anastasia. Is that, or was it from?
Yes, the one about extending to, it's a question around extending to branch campuses. I think that with any sorts of needs assessment, they sort of like qualitative research, there's different iterations. So at some point we have to land somewhere, and then we take that information, I think, probably to consider to branch campuses, especially if they have health professions elements, and make sure that we're aligning from those perspectives too. So I think that's important to consider in future ways of using this assessment to broaden it, to get a further dialed down approach to thinking about what the needs really are.
I would just add one other element is that, over the past, I think 16 months, each entity did a inventory of historical efforts to promote DEI, which is currently still undergoing final edits for the historical report. As we think about workforce efforts, pathway programs, pipeline programs as a historical term, look at your notes, look at the notes that you gathered in looking at our historical workforce efforts, our successes, our challenges. Consider a SWOT, right? As we think about what we're currently doing and what we want to do in the future. But, in building off of what I think Gurdeep and Lindsay are commenting, there's data, but there's also the work that we've done. And it's important to take note of those historical activities so we continue to build upon them and make them better. So with that, I want to thank the Workforce Committee, one of the 4 core committees of the IEC. Thank you for your leadership, Lindsay and Gurdeep, and all the committee members. We're going to transition it over now to Dr. Singh to provide his DI update from SRMC, Sandoval Regional Medical Center.
Perfect. And just want to make sure everyone's seeing my intro slide in the correct mode, correct? I feel like after all these years of Zoom, I'm still always trying to double check. All right, excellent. Thank you, guys. Well, I want to thank you again for all attending, and I'm going to be going over an overview of our DEI and well-being efforts here at SRMC for those who may be unfamiliar with them, and I'm happy to answer questions towards the end. On our first slide, which you're going to see here, right now our work is primarily broken into 4 committees, and I'll talk about these committees, and I also want to talk about the organizational level of each of them. And ongoing discussions, and I think throughout our HSC, it's important that all these efforts do not live in a silo, that they're engaged in all levels of leadership and from all employees as well. So what you're going to see here is kind of our hierarchy, if you will, even though I don't love that word, in terms of how information flows from our committees to a council. And this is our DEI Wellbeing Council that meets quarterly. This is an open meeting, and it's open to essentially all of our employees to attend. And due to work constraints, I know a lot of our employees are sometimes unable to make some of these smaller committee meetings that you'll see below, whether it's foundational, peer connections, arts and medicine, or community engagement, so they can get quarterly updates and know where we're moving towards and what some of our wins have been and what we're working on in this council. And then this also does report up to the board of directors, and we also have an advisory board who we're in a little more regular contact with. Something else I mentioned was the importance of the cross section of the people who are doing this work. And here at SRMC, with the support of our leadership, it's been critical that we not only want frontline folks, but we also want managers, directors, and all levels to be engaged in this. So for all of our managers and directors, they're asked to take part in one of the 4 below committees you'll see at the bottom of the slide there. And I'm going to talk about each one as we move forward, but I'll just call out who chairs each of these committees as we move forward. So our foundational is chaired by our quality leader, Robin Cole. Our peer connections is chaired by our leader for nursing education, Lindsay Baumke. Our arts and medicine is chaired by our very own CEO, Jamie Silva Steele. And our community engagement is led by our our case management manager, Melinda, which is just really awesome to see. I'll talk a little bit more about each of these committees. I won't read this slide, but our DEIW, you saw that council. We do have a charter in place. Our voting members and are a large part of our leadership team, as well as other managers and directors. And we really try to make sure that those 4 subcommittees that you saw are addressing some of these items that are underlined, really about engagements, meaningful opportunities, all leading to enhancing our emotional well-being, a sense of belongingness, and really our self-advocacy. So I'm going to talk about the foundational committee. These are just some very brief bullet points for you, but really this is probably one of our smaller of the committees. And what we look at is actually mortality reviews. At SRMC, we're a small enough organization where each mortality is reviewed under a DEI lens. And by that, I specifically mean we look at outcomes for where there are barriers in care that may or may not have existed due to language preference, other cultural issues. And we have essentially real-time tracking, looking for any disparities that might be starting to bubble up. So myself myself and the chief medical officer and others from quality could start to address those immediately. We also look at ILS reports as well. We just went through our TJC accreditation recently, so a lot of that work when it comes to policies, procedures also falls under this committee. And any mandatory trainings we have here at SRMC, we also view under this committee. So we do have unconscious bias training. We have other diversity, equity, inclusion offerings that we've worked into a mandatory cycle for many of our employees. Some of the deliverables and some of the things that this committee is working on currently is our ILS reports. We're working with Fabian and his team downtown, and looking at that and where those gaps exist and how we can best address those. We're also looking at the social determinants of health. As many of you know, we are collecting that data. That's, again, part of regulatory requirements, but how we act on it, what we're doing with it, and are we moving the needle is still an evolving conversation. And really how we're pooling that data is still an evolving conversation that Dr. Kaufman, his office, a number of leaders are actually working on throughout HSC. So we're just trying to work with them step in step. Something else that's not really mentioned here because it's more of a function of the medical staff, but something that I personally do is I'm the chair of a committee that's called the peer review committee. And that's really for whenever we have adverse outcomes or there's issues of professionalism amongst the medical staff. And as part of our process, I've redone the orientation and our forms that we look at with those cases. And part of that is to look at not only the event itself, but also looking at gender, ethnicity, language, and some of those things that revolve around those events of professionalism and how we can move from a culture of reprimanding to a culture of mentoring and building up. And that's been a big emphasis over the past 2 years as well. Our Peer Connections Committee, like I mentioned, I hope everyone's familiar with our peer connection programming that we have throughout HSC. At SRMC, this is not only for our clinical, but our non-clinical staff as well. We work with Steve Nuanez and his team as well for many of these interventions. And again, I don't want to read through these slides, but in short, when we do any orientations, we do our NEO is new employee orientations. We do that for both all staff who's truly SRMC employees. We also do that for all faculty who are 9 times out of 10 School of Medicine employees. We have resources available for them, and we personally kind of walk them through our DEI activities and committees during each of those orientations as well. Part of our Peer Connect too, we've been doing QPR training, and part of a recent win from this committee is they recently got a Johnson & Johnson grant. It's a small one, but it'll really kick off a lot of our QPR activities here as we're doing many QPR activities throughout HSC. Arts and medicine, just to be very brief with this, any coordination of arts and music through SRMC comes through this committee. There's some exciting things on the horizon that we're looking to expand some of our installations. And there's also a number of local artists who come through SRMC on a routine basis as well. That is really fun and interesting and engaging for both faculty as well as our patients and all staff. Community engagements, just very briefly, this is both internal facing and external facing. By internal facing, I mean all the awesome things Dr. Sanchez went over, talking about our Heritage Months and the expansion of those Heritage Months, as well as other activities that take place. The external facing has to do with some of the Pueblos and Native communities who we interact with. Actually, today, our Native American liaison, our CEO, and a few others are at Jemez Pueblo for a listening session. And so we regularly engage in those, and those key findings come back to this committee to be rolled up as well. I think everyone's aware of the Heritage Months. Dr. Sanchez went through that. I'm excited to add more tiles to this and to update this slide as we start to add in all of our new events. And we do have this email as well for any kind of well-being or DEI events happening at SRMC. Our faculty, this is shared at New Employee Orientation. They know to message this. We have a centralized kind of warehouse or email, if you will, to help address all of these items and to make sure that people are looped in. And if anyone has questions, this is an easy way for them to ping us. So we always go over this at our orientation. Just some brief milestones and some things that we've been working on recently. Again, I've already talked about our new employee orientations, and we really have our Native American liaison also present during each of those, so they understand the unique makeups of Sandoval County and some of the historical significances of our pueblos and tribes in this area. For those of you who are familiar with Vizient, it's essentially a data warehouse, and they pull your info and they cohort you respectively. So for us being a smaller community hospital, we're in a cohort of about 268. We were the top of that. And so that was really great. And that contributes overall to 5% of our total Vizient score. As I've mentioned, we have standardized unconscious bias and diversity modules into our mandatory trainings. We're supporting National Heritage Months, as we talked about. I have previously talked about our inclusive bathroom signage efforts. And again, our peer review and our mortality review, I think, is something that's unique. And I'm glad that we're able to do that on an individual basis. I won't play this video at this time, just given time, but we've done some really interesting work, and we're looking through that Arts and Medicine Committee to continue to have active voices of our community seen and heard when people walk through our hospital. So I would just encourage you, I know downtown recently has been doing this as well in some of their spaces, but beyond just getting art and putting it on a wall or a tab, something I would encourage members to think about, and they could work with our HSC marketing team and UNM marketing team, is to really have those artists tell their story and say why this piece of artwork is important to them and what it means to them, what it means to their community, and what it means to the state of New Mexico, and to hear their voice. And that's something we've done with some of our artwork here. And then you could have QR codes, so people walking by through our facility could really see that echoed throughout the facility. Lastly, I'll just close with this quote. I always love this quote, and I've probably shared it here multiple times, but looking at that overlap between our joy and our service and making those one of the same is something I know continues to kind of replenish the well and bring me back each time. And so I would just encourage everyone to kind of think about where those overlaps are in our service and what brings us joy, and to try to bring that more and more into our daily lives and into the work we share with one another. So thank you all also for Dr. Sanchez and everyone who's a part of these DEI efforts. All of you replenish my joy. So thank you so much for that. And that's it. I'm happy to answer any questions as needed.
Excellent, Dr. Singh. Thank you so much for your leadership in SRMC and for the entire SRMC community and family for continuing to champion DI. Your art example made me think of Art Walk, right? So it's nice not only to participate in artwork the first Friday of every month on Central Avenue, but more importantly to live it as we're walking through our hallways at SRMC and hopefully our other entities. Questions, thoughts, reflections from everyone?
I just want to say that the collection of social determinants of health data, I think, is really an important step forward for health systems. I do a lot of research with people who are unhoused. And one of my primary concerns is once they come to an emergency room, is anyone indicating that they might be housing unstable, and how might they be able to be connected to other services? I think that's just a good thing that you're doing. I'm unaware of if UNMH Maine is doing that, but if we aren't, we should. And if maybe there's a connection to be made to NMDOH for another type of epidemiological surveillance system, that might benefit both parties as well.
Yeah, thank you for those thoughts. As part of our CMS for all inpatient stays, they are asking some mandatory requirements and some mandatory questions, and that kind of data is being pulled. Dr. Kaufman's really been leading a lot of those efforts and is aware of some of the data. And HSC was also engaging in conversations with the state, because this is not only a UNM, quote unquote, UNM issue. This is a state issue, is how do we take care of individuals as a state? And so they've been looking at possible vendors and possible ways to really expand the amount of services and what we can do for individuals, and how we also look at that data in an even larger perspective than just maybe 1 or 2 hospitals. Lastly, just very briefly, as part of something that's happening, I think many faculty are aware about, and some folks have asked me about, is the merge and what that means, or what does that change. And what I would share right now is that this, in many ways, I think is not going to affect any of the DEI or well-being work. If anything, we hope it's only going to augment things further and encourage even more collaboration and even more communication. And I see Fabian as my counterpart here as well. So I've already been working with him and appreciative of his leadership, especially when I was talking about those ILS reports, for opening up some of our interpreter services again. So only those services will only grow and expand, I see, as we continue to merge. And I think that's going to be a great change as we continue to grow together as a health system.
Gurdeep, could you share a little bit more about the CMS requirement? It seems like it's not a requirement this year, but it will become more of a requirement next year. And if you could just share CMS, because our community is so diverse. So we do have practitioners, but then we have people across our workforces. And what does it mean for different people, the learners, faculty, and staff? It might be a group, but starting with you to share your thoughts.
Yeah, absolutely. Great question. So as we looked our Centers for Medicaid and Medicare Services, there is a lot of things, and I'll just talk about very grand scheme. What I think happens with change very often and with policy, and through a CMS in particular, and some of our accreditation bodies, such as Joint Commission, is first what we do is they will pilot things. They will ask for feedback from a specific cohort about, this is a change we'd like to see. What is your thoughts or ideas around it? They then will incentivize reimbursements as a bonus for those who are partaking in it or adequately reporting. And then over a period of years, they will start to penalize if you're not reporting and not doing those things. So as you mentioned, some of this, and I'm happy maybe in a follow-up email to this group, because there are some specific requirements. And maybe again, for TJC, it's called elements of performance that are revolving around this work, and specific articles that are put out. So again, just looking at time to speak, and I'm happy to, if any others would like to weigh in on this, please feel free to do so. But I'm happy to maybe just send out some links that will really talk about this more in depth. And I'm happy to share what SRMC specifically is asking and what we're looking at. And again, some of that information. Does that answer your question okay, Dr. Sanchez? I know that's a very big question that you asked. I think there's whole seminars about going through those elements and working through those.
Yeah, no, I think it's the beginning of a very important set of discussions that are going to be emerging more and more as it becomes a required measure to report on the inpatient quality reporting and other metrics. But thank you for bringing it up. I don't know if anyone else would like to comment on the new CMS SDOH requirements, social determinants of health, or any other question. We are down to the last 5 minutes. So this is for any announcements or questions for any of our speakers. Okay. Well, another high bar has been set. Thank you so much, SRMC, for your efforts. I will stay on if anyone wants to have any additional conversations, but thank you everyone for joining this Inclusive Excellence Council meeting. Please keep in mind the book club, reaching out to colleagues, each of the committees that presented today, workforce, participate in the community engagement event shared by Dr. Flegg, and just enjoy the last couple of weeks of summer. With that, have a great day. We'll be closing out a couple of minutes early. Thank you, everyone.